My name is Jordan Thomas. I am currently a nursing student at Aspen University. This assignment is for the course in 110 Foundations of Nursing Practice, taught by Professor M, due on September 27, 2021. This assignment is how nurses should communicate with physicians using the SBAR process. The scenario I chose for the SBAR process was scenario number 1. Scenario number 1 reads, Mr. O is 63 years old. He was dizzy and lightheaded at home and almost fell. His wife brought him by car to the ER. Mr. O was admitted to AMU with syncope. This is not his first time being admitted to the hospital. He has been treated in the past for congestive heart failure and acute myocardial infarction. He feels like he is pretty healthy as he only takes NSAIDs at home for chronic back pain. Mr. O got to AMU at 1600. His nurse is Jenny RN. Jenny RN assessed him and found his blood pressure of 138/84, pulse 76 and regular, and his respiration rate 16. He is afebrile at 98.6. Mr. O's labs were normal, but his IV infiltrated during transport. Jenny RN started a new IV and put a warm compress on the old site. Jenny RN reported to me, Jordan RN, at 1900. At 21:30, the PCA found Jordan RN and told her that he had just helped get Mr. O off the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Jordan RN went in to assess Mr. O. His vitals were blood pressure 94/66, pulse 114, and a respiration rate of 24. His pulse ox was 97. He was pale. His skin was clammy. Jordan RN asked him how he was feeling. Mr. O said he just didn't feel well and couldn't get comfortable. He asked if he could have something for his belly. It is really hurting. Jordan RN assessed his abdomen and found that it was distended, and Mr. O had diffuse abdominal pain. He rated his pain a 6 on a scale of 1 to 10. Now I'm going to read my simulation of this scenario. At 21:30, I was informed by the PCA that he helped him off the bedpan, and the PCA found that Mr. O had a large black tarry stool and was complaining of not feeling well. With this information, I knocked on Mr. O's door and proceeded to go into Mr. O's room. I then performed hand hygiene, then put on gloves. I asked Mr. O for his full name and his date of birth, and told him that I just became aware that you just had a bowel movement and are not feeling well. Is that correct? I informed him that I'm going to assess you to see what is going on and to see if I can make you comfortable. I started by grabbing his current vital signs, while observing how he looked, gathering subjective data on how he is feeling, and to have him rate his pain, as well as perform an assessment on his abdomen. His current vital signs are 94/66, blood pressure, pulse of 114, respiratory rate of 24, a pulse ox of 97. I observed that his skin was pale and clammy, and his abdomen was distended. I asked Mr. O how he was feeling, and he said, I don't feel well, I cannot get comfortable. Then proceeded to ask me for something for his belly. Then stated, it's really hurting. I told him I would call the physician to see if I can get something ordered for that discomfort, Then I proceeded to ask him to rate his pain on a scale of 1 to 10, and he stated that his pain was a 6. I then asked Mr. O for permission to assess his abdomen to confirm that it is distended. After this assessment, I informed Mr. O that I'm going to contact the physician and notify him of these changes and try to get you something for that pain. Then I'll be back in soon to check on you, but in the meantime, if you need anything, don't hesitate to push that call light button. After leaving Mr. O's room, I informed my resource nurse of these changes and that I'm going to call the physician. While reviewing Mr. O's chart for the physician's number, I also reviewed Mr. O's admitting diagnosis and date of admission and all other notes made on his chart. I will now demonstrate the SBAR communication process between the physician and myself. Hello, Dr. Mueller? My name is Jordan, and I'm an RN at AMU Emergency Department. I'm calling on behalf of one of your patients, Mr. O. I have noticed a few changes in Mr. O's condition since being admitted a few hours ago. Mr. O is in room 6 at AMU ER. At 21:30, he passed a large black tarry stool and began experiencing abdominal pain, stating that the pain is a 6 out of 10. Mr. O is a 63-year-old male who was brought into the emergency department by his wife this evening at 1600 because he was feeling dizzy and lightheadedness to the point of becoming unbalanced at home. He was admitted for syncope. He is currently taking NSAIDs for chronic back pain and has a history of congestive heart failure and acute myocardial infarction. Mr. O currently has an IV and his labs came back normal. When he arrived at the emergency room at 1600, his vital signs were blood pressure 138/84, pulse 76 irregular, respiratory rate 16, and afebrile of 98.6. I took his vitals at 21:30, and there was a significant change. His blood pressure was 94/66, pulse 114, a respiratory rate of 24, and a pulse ox of 97. While assessing his abdomen, he stated that his abdominal pain is a 6 out of 10. He also had black tarry stool with a distended abdomen, and his skin is pale and clammy. I was wondering if you could consult GI to come see Mr. O because he's presenting the signs and symptoms of gastritis. We may need further orders such as an NG tube, blood test, stool sample, possible endoscopy or x-ray, and to administer any medications to alleviate the pain and discomfort he is experiencing. Alright, thank you so much. Have a good night. Bye. Now I'm going to summarize this scenario. My personal thoughts on this clinical scenario were that there was ample of information on Mr. O. I was able to use this information throughout the nursing process to help me understand his situation and create a nursing diagnosis. Applying this knowledge to the SBAR process was beneficial because I was able to get the orders I needed to help him in a timely manner. A few things that could have been added to the SBAR was more information regarding the NSAIDs medication, temperature on the second set of vitals might have been helpful, if he had any allergies, and what his code status was. The most important missing piece of information is the NSAID medication. Knowing what type, dosage, and the duration he's been taking this medication could have been helpful in determining why there is blood in his stool. Knowing his temperature could have shown us signs of infection or inflammation. Out of the information that was given, we did not necessarily need to know that this wasn't his first time being admitted to the hospital. It is not crucial information for this scenario, but it is good to know that his IV was infiltrated during transport, a new one was started, and a warm compress was applied onto the old site. If we did this conversation again, I would gather more information from Jenny on shift change and ask questions pertaining his situation to ensure she doesn't forget to tell me something. And I will have all the information to start my shift prepared. I do believe that the significance of this situation was clearly presented to the physician, because the SBAR process I followed only contained vital information and was given in a clear and precise manner, while bringing attention to the drastic changes in Mr. O's condition. The physician was able to recognize the condition he was admitted in to what he is experiencing now through my detailed communication. Thank you.